Welcome to the Learning Lab. My name is Roman Garcia. Today what I'm going to do is I'm going to do a procedure that we discussed in the last video. I showed you some recordings of past patients that I have done, but I want you to see the procedure as it's being done. This procedure, as you recall, if you've seen the last video, is introducing a needle into the degenerative area with the objective of stimulating new vascular channels and new red corpuscles into the areas that's devoid of any nutrients. Now this procedure, I gave it a name. The name that I gave it is orthobiologics needling. Now needling has been around for a while already, and that's basically the introduction of a really small gauge needle into the very superficial regions of the skin tissue. But the orthobiologic needling is different because it actually penetrates through the skin and actually stimulates the bone tissue itself with the objective of reestablishing pliability in the tissue itself by inducing a very small trauma. That small trauma has tremendous biological significance insofar as rehydrating the tissue that's in a desiccated state. In other words, it's in a degenerative state. Now, this is my friend over here, Carmen, and she's going to allow us to film the procedure. Okay, so what I'm going to do now is I just want to show you how it's done. I've already established where the joint line is. This is the joint line right over here. I want to stay away from the joint line. What I want to do is I want to stimulate just underneath the joint line, the subchondral tissue. This is where the desiccation is taking place. It's right here. This is the area that I am going to stimulate. As a person develops degenerative changes, it's either on the inside, on the outside, or it's on both sides. Carmen has it on the inside. She's basically in a various type of degenerative pattern. This is the area that's collapsing on her. So this is the area that we want to reestablish pliability. And we're going to do it through a very small traumatic event via a very small gauge needle. Now this is the needle that we're going to be using. This is a 25 gauge needle, very thin. We're going to introduce it right into the subchondral tissue. We're going to penetrate the skin and actually make contact with the bone itself. We're going to cause it to bleed. It's not painful. Now this is it right here. This is the area we're going to be stimulating. Okay, so this is what we're going to do. It's very simple. We're going to go in. Actually make contact with the bone. Usually this is the first time we're doing it with honor. Usually when we do it, the first time, the blood that comes out is usually it's a dark red. Usually this means that the blood is devoid of any kind of nutrients. And we want to cause it to bleed. You can see the blood over here coming. She didn't bleed that much. That's very significant. Normally I would get a little bit more bleeding, but in her case, and she's been under this degenerative state, the bone tissue is devoid of any kind of vascular channels penetrating into it. The bone is naturally very hard. It doesn't have much pliability, but as the bone gets closer to the joint surface, there is tremendous amounts of pliability in the tissue itself, and that's the property that you lose when you're in a degenerative state in the knee joint itself. Now, we're just going to stimulate just one more time. Again, I always use sterile equipment. You can see that blood is starting to come out. It's not that much. You can see how dark it is. If you can get a real good close-up, Carlos, you can see how dark red it is. Oxygenated blood, plasma, serum that's not full of cellular toxic debris tends to be a very bright red. We're just going to stimulate it just one more time. Again, I'm touching the bone tissue. Again. This is all we're doing today. We'll retreat. You can see the blood coming out. It doesn't come out much. It's just a little drop. There's not too many red blood cells in those drops right there. In a normal joint, remember the body is full of capillaries. It pretty much invests every square millimeter of your body. we should get in a joint that's normal and it's well hydrated and it's pliable, in a knee joint, you would get more bleeding than this. But again, we're dealing with tissue that's very desiccated. Now, what she's going to end up with tomorrow is bruising. She's going to end up with some bruising marks around this area, which is a good thing. All bruising means is that the capillaries and the lymphatic channels in the region are actually developing circulatory. It's a circulation that's forming, and that bruising denotes the body's own regenerative repair cycle. Now, this is pretty much the treatment for today with Carmen. We're only treating one joint and we treat one compartment at a time. We're going to continue treating her. We're going to emphasize that medial compartment because in her case, that's what the evaluation reveals. She's in a various type of degenerative pattern. But we're going to continue to stimulate until we start establishing pliability in the tissues, which we will know because we have a baseline before we did the procedure. And obviously, she's going to start feeling better. So anybody who watches this video, if you're interested in knowing more about orthobiologic needling, there's always a phone number on the videos. Give me a call and I'll be glad to discuss the procedure with you. Until next time, thank you.